The teeth. The bad marriage, unhappy childhood, food allergy, and leaky gut, SIBO, others. The 7 factors of ART. What about the dental fillings, jaw alignment, mercury toxicity, food allergies? Interference feels like scars or toxic ganglia. It could be structural, osteopathic, or chiropractic issues. With the cumulative overload of our systems by all of the above, every detail of a patient's system should be looked at and corrected if possible. However, none of these issues explain the explosion of chronic illness in the recent years. They were always there and have not increased at the same rate as chronic illness has. What about psycho-spiritual or emotional issues? Today it is very difficult to determine if the patient's emotional or spiritual issues are the cause of their illness or a byproduct of the disruption of their brain chemistry and metabolism by chronic infection and accumulation of toxins in the CNS. We believe, based on our combined experience, that these issues, which are part of all of our inner lives, should be addressed alongside with the treatment of the physical or energetic problems and not overlooked or looked at as like a separate issue. It is known that the objective emotional or psychological triggers of our time, such as domestic violence, abuse, war-related trauma, starvation, and migration, have not increased in our Western world at the same rate as chronic illness has, and therefore cannot be the true cause of exponential increase in chronic illness. However, all of these issues greatly affect our ability to fight infections, eliminate toxins, and modify our pain pathways, and decrease our sense of wellness, and increase our perception of illness. We are suffering. Not including psycho-emotional work in the healing process is a grave mistake, but using the psychologic model of illness alone will distract from the true man-made causes of chronic illness and put the blame and guilt feelings back on the client instead of putting it where it certainly belongs. The greed, ruthlessness, and lack of conscience of corporate structure are violently opposed on our world. Every physician, every recovered patient should become socially and politically active to stop and turn around the seemingly runaway train of toxicity and abuse of the earth.